This is Nursing Uncensored. Your host, Adrienne Benning, invites you to listen in on real conversations about all things in the nursing world. This podcast is intended for nurses, nursing students, and allied health professionals, but non-medical folk will probably get a kick out of us too. If you like what you hear, subscribe and share. Welcome to Nursing Uncensored. I am here today with a really important message and a really special guest. Welcome to the show, Dr. Curley.
Hi, Adrienne. Thank you for having me. My name is Dr. Loreen Curley. I am a family nurse practitioner. I work at the University of Iowa hospitals and clinics. I specialize in sleep medicine, and I see geriatrics, adults, and pediatrics, specializing in sleep medicine. That may not sound like a lot, but you'd be surprised, how much
covers a lot.
How much sleep can actually cover. Currently, I am seeing patients through telemedicine, which is honestly huge for me. I'm doing both telephone and video visits, so it's really cool. And I'm not very well, I would say I'm semi-tech savvy, so learning all the new things that go along with telemedicine is it's really cool. It's really fascinating. Shout out to all like the IT techs and just everyone working behind the scenes to help us keep patients at home and just help decrease the risk or the need for people walking around in clinics and things like that. So, with that being said, I just find telemedicine to be amazing, and it's just a really cool opportunity, and I'm glad to be doing it. So I think it's really cool, just kind of the benefits of how telemedicine is working and how it just kind of fits in, providers' lives and their roles and stuff. I think it would be really cool, like if this could be implemented within the Indian Health Facility. I would totally be down for being a telemedicine provider. I could work from here and still provide patient care over there. So that would be really cool. I don't know how or when, how far up that is, but
figure out step one. Don't worry about step 7. worry about the first thing. That's a great goal.
Isn't it? That would be really, really
awesome.
And
the first goal is to learn how to do telemedicine, which you're already doing step 1.
Exactly. Yeah. So now I just have to find a whole support team that's willing to do this.
That's all.
That's all, right? I can do it tomorrow.
Maybe there's someone listening right now that's like, hey, but that's really cool. Telemedicine has really helped keep healthcare moving because we don't need people coming in droves to clinics, especially when I have family that was worried about going to have they have routine blood draws, and they were just worried about going into the clinic for their blood draw. And so there are accommodations made for that. But yeah, telemedicine is fantastic, and I know that the university is using that. I actually have a telemedicine appointment at 8:00 tomorrow morning.
Yeah. Oh, wow.
Good yeah, I do. So,
yeah. Good luck.
Yeah. Well, I'll tell a quick little side story. So I have, my audience knows very well that I am a migraine sufferer and that I need my migraine prescriptions refilled. So at first I called and I said, hi, I need an appointment. Yeah. And they were like, well, and I was like, I'm a nurse that's about to start working in ICU, and I'm not an ICU nurse. And she went, oh, how about tomorrow morning? And I was like, that's the right answer. Keep me sane, keep me migraine free.
There you go.
Keep showing up to work.
There you go.
Anyway, that was a little side note. But,
okay, since we're doing side stories, I'll do a side story. It. What's really cool, I guess, I know this pandemic is we're all in a hard spot, but just being a provider and being in my role, people, during my appointments, I'm being asked more questions about, do I need to go to the hospital for, I'm having this or this, and So in a way, I'm kind of helping
Mhm.
triage people to, if they feel like they do or don't need to go to, whether it's to the clinics or to the ER. So just the way everything is kind of flowing with, with the university, I think it's working. Do you feel like it's working? I think so too.
And I will say this as a side note. Well, I guess this is all one big side note, but
Side note.
I yeah, a couple weeks ago, I woke up to get ready for work, and I woke up and I was coughing, and it was a dry, painful cough, and my throat was sore, and my first thought was, "Oh my God, no, I have to be at work in an hour and a
Mhm.
half or 2 hours or whatever." It was like 5 o'clock. I called staffing, and staffing said, "We're signing you off. Call employee health." I called employee health, and they were kind of setting me up with an appointment, and they said, "Okay, next step, the clinic is going to call you. They'll set up an appointment. We'll get you in to test you as soon as we can." In my mind, I'm thinking, they'll probably call, it's after 5. They'll probably call me tomorrow, and then maybe I can get a test tomorrow. When I hung up the phone with the employee health clinic, I already had a voicemail from the testing clinic saying, "How soon can you be here?" And I was like, "Oh, I just woke up. Like, I
Mhm.
haven't even brushed my teeth." And they were
Yeah,
like, "Cool, come in an hour." I had my test in an hour. I had my results the next morning.
that's
So
awesome.
I do want to say that I feel like our institution has stepped up,
Hmm.
and I know that they're doing quite a bit of testing. So
You
yeah,
know, what's interesting is this conversation is a really good comparison to what we're going to be discussing. So,
yeah, yeah, and
yeah.
I think it's important that we all kind of think about what we have where we live, and then put it in the
Hmm.
context of like what other people are experiencing. It's
I
a
agree.
an
I
important
agree.
step in empathy
Right.
for our fellow humans. So yeah, let's talk more.
Okay.
I'm excited about this.
All right. Let's do it.
Full disclosure, before you were a nurse practitioner, you worked lots of different hats. You were a an instructor for nursing students.
Yes, that's right.
You
So
worked
for
as
a
a floor
semester,
nurse. Like, you've done so
yeah,
much.
so before I was a nurse practitioner, I was a floor nurse at the University of Iowa Hospital and Clinics. It was like, it's a step down ICU. It's called Rescue. Shout out to all my rescue
Yeah.
colleagues. And after I got my DNP, I taught a semester for nursing students.
Mhm.
I helped them with their clinical rotation, very exciting times. And then before that, I had various CNA positions, CMA positions. I had the role of distributing medications in the nursing home field, and then I was, in that role, I was also a nursing assistant.
Mhm.
So in various nursing homes. So I, kind of throughout Iowa, different places in Iowa. And then there was one facility in Tempe, Arizona. I had worked there for a short time, but most of actually, besides that one short period in Tempe, the rest of my nursing background, my nursing practice background is here in Iowa,
Mhm.
and mostly in Iowa City.
Yeah,
So
and you do have a special connection to Arizona, and that's a lot of what we're going to be talking about today.
yes,
We have some business to take care of because, as we
yes,
know, we are all, as a globe, we're dealing with COVID, this coronavirus, SARS-2, basically, however you want to title it, and it's affecting people around the world. But of course, we're seeing other groups of people, specifically people of color, that are seeing disproportionate um, consequences from this virus. And
right.
so we're going to talk specifically about one particular group of people. And I would like you to talk a little bit about what group, very important group of people we're talking about today.
Yes. So one of the reasons I was interested and motivated to do this interview with you was because, so my heritage background, I'm Native American, Navajo, Dene, originally from Arizona. Arizona is a community that's part of the Navajo Nation in Arizona. And currently, so as of yesterday, April 20th, 2020, there were 1,300 21 positive cases of COVID-19 and 45 deaths. So and there's been a significant increase in cases since this past Saturday. These numbers is according to the Navajo Department of Navajo and Navajo Area Indian Health Services in accordance with the Navajo Epidemiology Center. So this has been just very important to me because, with me living here in Iowa, I've, just been kind of watching these numbers increase just, day after day. And it's important to me because it's affecting the people, my people, I guess, my family, my classmates, people I grew up with, and it's hitting them, and it's hitting them hard. I had a second cousin who recently passed away from it. My grandma's sister tested positive, and she just recovered, and she's now back at home, and she's doing okay. So that's
I'm
good.
glad she's back at home. Yeah.
I am too. I'm very excited to hear that. I just got the update from my mom that said she was at home doing well. So that's good. Just watching as these numbers increase, it's just really personally affecting me. And what I wanted to do was talk with you about the history and maybe a little bit about, why these numbers are the way they are. If there's any listeners out there willing to help and contribute, I have some resources that if anyone's interested in making donations or contributions to help with supplies, and that would be really,
Yeah, and we've talked a lot about this on the show about how as nurses, we have this collective experience. And if one of us is suffering, then all of us are kind of collectively suffering. And when we have groups of people in this country that are being like the rate of infection, when you look at the population, is much higher than that of the general, I'm just going to say white population, for lack of, even though I know that there's lots of demographics in this country, but generally speaking, this is a problem. And we're going to talk about, as we go through this, we're going to talk about what factors have created this, because this is not like all of a sudden, poof, these conditions came out of nowhere. A lot of these conditions that are creating these problems have existed for a really long time. Now we're just putting a magnifying glass over this with everything that's going on. So our goal is, yes, exactly this, to talk about this, why this is a problem, and what we can do about it. Because I don't think that we're a country, or nurses are not people of inaction. And so I'd like to see this message get out. So talk a little bit, please, if you would, about kind of what you're hearing and seeing from back home.
Yeah, sure. So another, just something that was really brought to light to me is, I live here in Iowa City, and anyone who lives in Iowa knows Iowa is just a place where everyone is welcome. There's not really a lot of negative stereotype or just anything bad I could say about Iowa. It seems
people smile at you on the street.
People smile at you on the street. People wave at you
in the grocery store.
Yeah, it's very just down to earth. Everyone's really friendly, and that's part of why I just love Iowa and I love Iowa City. So I'm in this Facebook group, this quarantine group, and just watching the community in that group come together. It's, I guess it was initially supposed to be for like, if, us to support our local restaurants and just, for us to kind of reach out and figure out ways we can help our small businesses. That's kind of how it started, and it's doing that, and it's great. But occasionally, there's been people that will comment, say, hey, I need help here, for something. And then someone else in the group will volunteer and say, I can do that for you. And, they'll drop off supplies or something like that. And I just think that's amazing. And that's just what Iowa City is. So there's that. And I'm just like, wow, Iowa City's great. But then, going through, social media, and then I look at the Facebook groups that I'm in from back home, and there's not a lot of that kind of positivity. I think recently, since I think a lot more people are recognizing the impact that the virus is making, that now maybe within the past week there are more people that are, reaching out, and there are more groups that are helping. But kind of, when these numbers were trending, I just remember there was one group, somebody had commented in that group saying, hey, when you come by the store, please, wear your gloves, wear your mask. And the people in the comments were commenting, they weren't taking it serious. They were making jokes. It just was really negative. And when I read those comments, I kind of knew at that point that just this is not going to go well. So just noticing those differences, and just, it just continued to just affect me. And I felt like I continued to feel like I needed to do something or say something, and just to get my the awareness out there to, your listeners, and to see if there are people that can help and are willing to help contribute. You know, just this past week, it's now mandatory. It's required that everyone has to wear masks. And if you look at other parts of the country, governments have been making these suggestions or these changes a lot sooner, but this is something that just started this past weekend. So I know the Navajo Nation is definitely in need of at least, handmade masks.
And I want to clarify for people that are listening that the Navajo Nation is a sovereign nation, and there's a lot of history wrapped up here. As we talk more, we're going to talk a little bit about this, because I think it's really important to understand where these problems stem from. And of course, we're not going to solve all the problems, and we're not going to be able to cover all the history in this episode, but it's at least important for people to understand, because there's a lot of stereotypes, a lot of racism,
Mm-hmm.
and a lot of problems that got us to this point to begin with. So we're going to try to dispel some of that, but you're talking to your people directly and saying, like, this is not a
Right,
joke.
right.
And it's really important that we talk to these communities that maybe aren't taking it seriously or don't
Yeah.
have the resources. Where does
Uh-huh.
the Navajo Nation primarily live? Like, what part of the country are we mostly talking about? Now, I
Mm-hmm.
know people are dispersed throughout the country and the world, but primarily, what are we talking
Mm-hmm.
about here?
So the Navajo Nation is primarily, it is the largest reservation in the country. It's primarily in Arizona, but it's part of Utah and New Mexico as well. So it's very close to the Four Corners. If you look at the Four Corners where they meet, Utah, New Mexico, Arizona, Colorado, the Navajo Nation is kind of in the top corner of Arizona, and of course a little bit of Utah and New Mexico. Population is over 150,000 people, just a little bit over that. So, according to the 2010 U.S. Census. So, with the Navajo Nation being that size, I think that's one of the primary reasons why they're having these why they're being affected the way they are. The Navajo Nations, the Dene, we're very rich in our culture and our tradition. There's a college there. You can, you take college courses, you can get a doctorate degree there in Navajo education. So there is a lot of positivity that they're doing, and it's just the Navajo Nation's kind of just always been a little bit behind the rest of the country, but in their own way, they are very rich. We still have their traditional way of living, traditional way of, traditional backgrounds. So they're rich in their culture and their language.
Yeah, so you've talked a lot about,
It's
like,
hard.
the way your family has contributed to this culture, and like the art, the artistry, and the craftsmanship that's come from your family as well.
Yeah. So I come from a family of weavers. My grandma learned how to weave from her grandma. She made rugs. So my grandma, made her living by making sash belts. And these sash belts are used for like traditional dances, or just nowadays, it really just for fashion.
Hmm.
She had taught her children, and like my aunt, who have taught their children. So a lot of my cousins still do it to this day. They still make these traditional belts and sell them. And, my grandma had taught her sisters, and her sisters had taught their kids. So, in my family tree, we have a strong family history, a strong background in weaving and making traditional belts, also silversmithing as well. So a lot of these, things I'm talking about, the belts and the jewelry, it's back then it was used mostly for traditional ceremonies and dances and stuff like that, but it's still used that way to this day. But to this day, a lot a lot of it nowadays is definitely used for fashion, for
It's like
sure.
everyday wear. It's not
Yeah, it's
reserved for
everyday
those
wear.
special
Hmm.
occasions, which is
Yeah,
beautiful because I've
right.
seen some of this stuff.
Yeah,
It's gorgeous and it's skilled
yeah.
work. Like I couldn't do it, obviously. So
Hmm.
this is a tradition. So yes, the culture is there. There's a rich, rich history there.
Hmm.
We're by no means saying like, oh, these poor natives.
Right.
It's more like this is a
Hmm.
culture that's already really important, and we need to make sure that we're fixing those parts that have kind of
Hmm.
fallen by the wayside. These.
Right. Some of those things, the people suffer from is like poverty and
Mhm.
unemployment. What's interesting is growing up as a kid, and being a teenager, I never realized or never even identified myself as someone who lived in poverty, only because my grandma, she made sure that I had everything that I would want or need to make my just my home living situation comfortable. I had a roof over my head. I had clothes during the winter. We had hard winters, and I had a stove in my living room, and I learned how to build a fire, and we had coal. In the summertime, we'd have to put water in our air conditioning to keep the house cool in the summertime. And this is just the way we lived. And growing up, it wasn't until in high school, or maybe even not until I started college, that I kind of looked back and, saw that people from outside of the reservation looked looked at us, and that's how we were labeled, as people of unemployment and poverty. But me
Terrible
living there,
stereotypes.
yeah, but me living there and growing up there, I would never have thought that that's what we were, and that's who I was, because I wouldn't have identified myself as that background, because
But
of
that
how
just,
I was raised, because I was taken
yeah.
care of.
And that just goes to show that the love in a home is more
Right.
important. You can have a rich, happy
Hmm.
life and still maybe not have these like measures of wealth.
My grandma, she made her living by making those belts and selling them. She knew different designs that other pueblos use, like pueblos around New Mexico. And so, she would sell those belts because the other cultures, around New Mexico and other places, they needed they needed those belts for their dances and stuff. So that was how she made a living, and that was how she provided for us and provided for me as we were growing up. So from the outside looking in, I could see how, like, in the news, everyone's blowing it up and making it a big deal, poverty,
Mhm.
unemployment. And yes, it's true, but I mean,
It's more
I
than that. You
it's
can't
more than that.
define an entire group of people by circumstance.
Right. And, I was fortunate enough I grew up with water and electricity in my home. But like I said, that's just, that was my grandma. That was her personality. That was who she was. She worked hard. But there are families who, they live further away from communities that have like gas stations and grocery stores and laundromats. They live further out in the land, I guess,
Mhm.
and where they don't have the money, or they don't have the sources to connect water lines or to connect electricity.
And the
And
terrain we're talking about is effectively desert, right? I mean,
yeah,
we're talking,
yeah,
it's not like you can just like dig up some soft soil and throw down a water line. Like we're talking,
right. I mean, some places you can do
yeah,
that.
yeah.
But it's just
But it's like
people,
anywhere, the further out.
right.
Yeah.
Yeah, they don't choose to, because they've adapted to their way of living. I had a high school friend of mine. He commented on his social media. He was raised by his grandma as well, and she didn't have any water either. You know how pretty much if you don't have water, what people do is they go to the well, and they haul water back to wherever they live, and that's just how they took care of themselves.
And that's just normal. Yeah.
That's just how that's how they fed their livestock. My mom was telling me this story when she grew up, when my mom was younger and when she was being raised by my grandma, of course, they didn't have a shower or, like toilet, like plumbing. But my grandma made her own homemade shower, I guess. So what she did in the summertime was she laid out hoses so that the hoses would get hot, and then she would kind of hang the hose over like a fence or something, and that's how she kind of made them a shower. So
but that's just it. You use what you have. Like my grandma grew up in Missouri, and she talked about how they had an old bucket and they poked a bunch of holes in the bottom, and then would put buckets of water out in the sun, and then would take turns pouring the water over each other. To them, that was normal. That's fine. Even though I'm sure that somewhere else, someone had a different way of doing things. So we assign a lot of value to these things. But
and the thing is, like, knowing, of course, we need the water. There's more people going back to the same well, gathering together, waiting for water, and doing it multiple times a week. If not multiple times a day. And when we go to get supplies like groceries, necessities, it's not just down the street. Even where there are communities, some of those, the stores don't have everything you want or need. So you have to go to larger cities like Farmington or Gallup or Flagstaff. Those are some of the larger cities that are closest. They're called the border towns. And they're kind of right outside the Navajo Nation, and those are the more, because it's more populated, has more of everything that you need. Like even growing up, every other weekend, the thing was, we're going to town today. It was the thing to do. It was the thing to just get ready for. And my grandma would get ready, make a whole day out of it. You go to town, you get all your supplies, you go shopping, you get your laundry done. So you just kind of make a whole trip of it. And that's just the way it is. So with that being said, you just think about how that's affecting everyone now. The same people are still doing that same thing. You're getting large quantities of people going to town, interacting with each other, and then bringing the virus back to the reservation again.
Right. Back to these communities that if you don't, we've talked a lot about how it's difficult to follow instructions put forth by the CDC. Like when they say, wash your hands, wash your hands, wash your hands.
Yeah.
How do you do that if you have to go retrieve your water and you can't just go turn on a faucet and soap up your hands?
Yeah.
So that, in addition to the, all of these things are kind of coming into play.
Right. And then again, like you said, it's not just one family that needs to do that. All the families need to do that. So they're all gathering at the same places to try to do what's required or necessary.
Right. It's only a fraction of it, but I'm starting, even though I live in a community, I have a grocery store like 5 minutes away by car. I'm by no means living in scarcity. But with this coronavirus, I'm noting that I need to be more intentional with what I'm doing, making sure that everything I need is coming back with me. But I have the perks of being able to have delivery and like all these other services.
Right.
So when we think of people in the Navajo Nation, this is not like just order DoorDash.
Yeah.
This is survival. And this is also sacred land. And this is not just like, oh, we'll just move to this. No, this is home. This is your way of life. Just like I wouldn't expect someone to come to me and say, oh, Iowa City is having a food shortage. Just move. Like it doesn't work that way.
Exactly. It doesn't work that way.
It doesn't work that way.
That is a very important point in all of this. Is this isn't a situation where in order to help rates or, just to make your families feel safer, to a lot of people, it's not an option that they would move because, So the Navajo Nation is surrounded by these 4 sacred mountains, and them living within these mountains is very important to them. It's part of their culture, and it's for protection that they stay within these mountains. And there was even a comment about it on one of the CNN interviews, that it's hard for some families to accept that they have to get medical care outside of that. So they would like to choose to stay within those 4 corners and get treated at the hospitals there. But with everything happening with the COVID-19, in some cases, some of those patients, they have to be transferred out to, like Albuquerque or Flagstaff. And it's huge impact knowing that they live the way they live with their, the way their water and their resources are. A lot of the people would rather face, and figure out how to meet their day-to-day challenge than move somewhere else, like a city that has water. And that's just the way it is. And people they figure out a way to make it work. And I think doing this interview, I'm trying to help them continue to meet that. I want to help make it work. And so I want to do that by telling other people who live outside of the reservation that, hey, can we get some help? This is our home, and we're not leaving. So if we could at least help by, giving them at least some masks. So as we know, even just talking with someone, if 2 people have a mask and they're talking, they're decreasing their risk of contracting this virus just by wearing a mask.
Absolutely. And this information is important because we're all being bombarded by lots and lots of information, and it's hard to tell what's accurate and what's not.
Right.
So I know that we look to members of our own community to help us navigate this, because someone like you, as opposed to someone like me, understands the importance of that way of life, the structure of that way of life, and what things need to be brought to meet those needs. And so I'm going to include some other links with the blog post on the Nursing Uncensored website, but there was a video that I was watching where in one of the hospitals, they had kind of set up a bunch of like negative airflow rooms, and they were doing the best they can to treat people. But it's like any other small community hospital. Your hospital in whatever county, rural county, might not have an MRI or ECMO or any of these life-sustaining, supplies, and even right down to masks, like you were saying. Like,
Right.
it doesn't matter if you have all the ventilators in the world, if you can't protect your healthcare providers, you're you're fighting a losing battle. So it's really important that we do put the call out to say, this is the type of help that is needed, and call upon people to help, and then also to talk directly to people that need to hear it from someone in their own community. And I also want to point out just very quickly, Doug, actually, my partner, who's also friends with you, pointed out that it's also incredibly important that people in the Navajo Nation see that they do have, like, you have your doctorate, and you worked your ass off for it, and at no point have you, like you said to me at one point, I don't want to bring too much of your private life into this, but you said at one point that your son never saw you not in school. Like, through his whole life, he saw you setting this this example of, like, I want to do this, and I'm going to work my butt off, and I'm going to do this. And you've done that. And I think that's a really important message to take back as well, especially since so much of American culture does restrict and stereotype and create poor outcomes for the nation. So I think
I always forget that point.
yeah, I mean, and I don't want to dig too deep into this, but we also have to remember. So there was an article, I might jump ahead just a little bit in what we were talking about, and then we can come back to it. But let's see, where did I see it? Oh yeah, so okay.
Back
So
to
this is what I wanted. I'm going to read this direct quote. This is actually from an article on NBC News. And the article's entitled Coronavirus Batters Navajo Nation. It's about to get worse. And here's what it says. And this is the point I want to drive home because okay, I'm just going to read this. Our federal government, since the treaties were signed in the late 19th and early 20th century, has broken promise after promise after promise, said Allison Barlow, director for the Center for American Indian Health at Johns Hopkins Bloomberg School of Public Health. And what we're seeing today is the accumulation of these broken promises and where it has left people, and that in these treaties that there were this is not the first time that emergency funding has been very, very slow to show up, and that the Navajo Nation has already spent $4 million from its own coffers. And it's one thing to be able to like, yeah, okay, so they pulled from their coffers, that's great, but like this was already promised. Like this is
right.
unfortunately an uneven, unwilling exchange for things that were taken away from Native peoples in this country a long time ago. And I'm not an expert. I'm not trying to make myself sound like I know everything because I know very little, just what I've read. But it's really important that we help.
The Dene people, my people, we're the natives of America, and we're not going anywhere. And so that's just the way it is. So we're going to keep fighting for what's ours. And what's beautiful about my home is it's always going to be my home. I like to travel, and I'm out here living in Iowa, but every time I go home, I'm welcome with open arms by all my relatives and my friends. But at the end of the day, my aunts and uncles, they've always supported me and encouraged me. They, every time I go home, they say, they tell me, you're not done. You need to go back. So it's encouraging and it's supportive to know that, my aunts and uncles, I was raised by a single mother. I was raised by my grandmother. So when I hear my aunts and uncles, tell me that, it's like, it's my own parents telling me and giving me that support, when they tell me you're not done, you need to go back. And so I'm like, all right, I'm going back. Bye guys.
And I think it's important that we focus on those positive parts, the culture, the family, the support. Those are the things that keep people together. But the rest, we need a little help with infrastructure. Just like, not a lateral comparison, but just like the people in Detroit need water. This is not because they're at fault for this or that they deserve this. This is a fundamental flaw in the system. So let's talk about what some things are that need to be done, what kind of stuff is being done, and then we'll kind of round it out with what listeners, myself and other people listening, can do to help. So yeah, let's talk about what sort of things are kind of being done right now to help the situation.
The Navajo Nation, they are working extremely hard. The public health department, the Indian health facilities, all the local hospitals, they are working extremely hard to help bring these numbers down, but it's not enough. For whatever reason, people are just not listening. What they've put in place, and I think it started earlier in April, and it's kind of decided on like a week-to-week basis, but there's currently a 57-hour weekend curfew that starts on Friday evening, and then ends, I think, early Monday morning, like 5 a.m. on Monday. It has helped. It is helping. I've seen pictures from my friends in different towns, when they're, going to work or just walking around because they live in that town. They can kind of take like a quick, snapshot and then kind of run, go home without them being noticed, or if they're driving to work or something. So I've seen pictures where, it is working in some communities, but for whatever reason, it's not working in others. The police department is now finding people and either fining or giving them jail time for violating the curfew.
But they are finding people because
Right.
even though even with any human, if they don't respond to best advice, they respond to you wanting their money.
Right.
So you ticket somebody and that can deter that behavior.
So then the problem or the challenge with that is, the challenge with implementing the weekend curfew is that it's causing more people to have to go to town, the towns we talked about earlier, to get their supplies and their necessities during the week.
Mhm.
So now you have, like in Gallup or Farmington, there's lines of people at Walmart or Sam's Club, and the lines are going out the store and down, down the street because they don't want to break these curfew laws, but they still need to go to town to get their supplies.
So now they're all
So
just kind of going in a
so
more
now they're
controlled
just
time
going in,
period.
in large, they're still going to town during the week in large gatherings and still, putting themselves at risk and putting everyone else at risk.
Yeah.
So so like I said, the curfew is helping. There's fewer people driving around. Another thing I've noticed is, so a couple of my, my high school friends, they're elementary teachers. And so, they've commented here and there about the different things the Department of Education is doing. And so one of the things I saw is they make like workbook packets for their students. And so I believe it's like once a week or something, the students come to the school and pick up their packets. And so I've seen pictures of vehicles lined up outside the school waiting to pick up their packets. So there's a couple of other things. So this other girl I went to high school with, she was the friend of my late sister. She works in design, and I saw this on an interview. I saw this on the news. There was a video about it. She works in graphic design, and so she's helping by making face shields, with her department. And I heard, just through that clip that that's how she's helping. She's trying to get face shields out to send them back home.
Good.
The other thing I saw actually today was that it was a post by the president of the Navajo Nation. He announced that the governor of New York is also offering support. I'm not sure specifically what they're doing, but that's
Sure.
another post I
I
saw
hope
today.
they follow through.
Yeah.
I hope that happens.
And then the other thing I want to comment on, just through, my reading and everything, getting ready for this podcast, I've noticed there are more Facebook groups, more groups requesting for funds or supplies from different organizations and stuff. I found like 3 of them just as I was going through my readings and stuff. But so there are some significant changes out there. There are some improvements, but got a long ways to go to make even more improvements. So
Absolutely. And in the description, I'm going to list actually some links. There is one link that actually lists out the supplies that are needed in the community. And this is great because I know that here in Iowa City, I'd like to see this community sharing spread, but I know people are making masks. They're sewing masks. They're 3D
yeah.
printing shields. They're
Mm-hmm.
making those little hooky things to hook your mask on so that your ears don't get really sore. It would be wonderful if folks that are listening that are in communities that are doing this would maybe set aside some, ship them
Right.
to the nation because they're in really,
You're
really
right.
dire need
They
of.
are in, yeah, we are in dire need. That would be amazing. Yeah, the list, I'm just gonna rattle off
Please do.
some of the things that are on the list if anyone's willing to help. In the community specifically, the disposable mask, cloth, fabric mask, cleaning supplies, disinfectant wipes and sprays, liquid hand soap, hand sanitizer, toiletries, non-perishable food items, bottled water, baby necessities, firewood and coal. So there's a link there that it lists all the necessities. There's also another list that lists medical supplies that are needed for hospitals. I am actually in contact with somebody who works in the Chinle Indian Health Services Hospital. If anyone is interested in donating or somehow finding are getting together. Let me go through the list here. Hospital gowns, surgical masks, or face shields, or hand sanitizer. They are also accepting homemade masks, but they want to have the ones that have the slot to put a filter in. So those items specifically, if anyone is interested in donating those, you can contact me, and Adrienne will put my email address
Absolutely.
in her description. You can contact me and I will help you get linked up with the person there. But those are the specific supplies they need for the hospital. But these other items I listed, and there's more that you can look it up in the description. Those other supplies are needed within the community. So anything anyone can do to help is greatly appreciated.
I'm also going to link the GoFundMe page, because if you don't have
Okay.
masks and gowns, good old fashioned money helps too. So
Yeah.
I know I've been going around. I'm not wealthy, don't have a lot, but I've been going around making like $5 and $10 donations to places because people really need help. And
Yeah.
we maybe as individuals can't make a big dent in this, but collectively we can do something to help. So I'm going to include all these links and the information, links to also the articles that we've cited. Those will all be available. And if you Google this topic, you will find so much information right now. What I would like to do as we kind of wrap this up, I would like to give you the floor. I'm going to put you on the spot here. I kind of put everybody on the spot every episode, but I want you to talk directly to your people. Is that offensive for me to do that to your people? Does that sound acceptable? Okay. I want you to talk to the nation. You've got the floor. What do you want to say?
Stay inside, guys.
Stay inside. Wash your hands as much as you can. Oh, I'm also going to include a video that I found. It popped through on my Facebook feed. And it is a video of a woman washing her hands with a bucket and a cup. Shows you how to wash your hands without flowing running water. So I'm going to include that as well. Bar soap, cup of water, we can get your hands clean. I'm going to include all of that. And yes, it's important that people stay home as much as they can.
Yeah, I get so now that I've kind of, thought about what you're gonna say, don't include, let me re-say it, okay?
Sure.
Okay. You just caught me off guard.
No, that's okay. You've got the floor. What would you like to say to the nation?
Okay. So my comment or statement to everyone back home is please, do your best to social distance yourself. Stay home as often as you can. Only go to the store if you absolutely have to. Going to town, going to Gallup and everything, we all know and we understand that is absolutely necessary. There's no way around it. Please wear a mask. If you have hand sanitizer, please use hand sanitizer. There's also this whole thing about, people wearing gloves. Gloves are absolutely appropriate if you use them properly. If you put your gloves on, don't be touching your face and touching your pockets and your phones and things like that. They can be helpful if you use them appropriately. Mm-hmm. So if anything, at least, social distance yourself, stay home if you have to, and please continue to wear your masks.
That's as thorough and as good as we can get. We just need people to do the best they can. This is a lot of information, but I think this is incredibly important, and I'm glad that I'm able to give you kind of this. I'm no Joe Rogan, but people listen, and so I want this message to get out and to be heard in a very real way, because this is important.
Yes, it is.
And as much as we've talked about disparities and problems, we are all in this country together. However we came to be here from all different parts of the globe, we're here now, and we need to do the best we can to keep each other safe. because there are no bubbles in this country. There's nowhere that's going to be untouched by this. So we just all need to work together to do the best we can and support each other. So I again would like to encourage people to check out these links, donate if you can. If you're not able to donate, share these links and try to get other people that are able to donate involved. So Dr. Loreen Curley, I would like to thank you so much for bringing this message to our listeners. I know that there are a lot of people that this is going to directly impact. And so, yeah.
Yeah, thank you, Adrian, for allowing me to just be on your show and tell my story. And hopefully we can help a lot of people along the way. So
I hope so too. Excellent. Well, Dr. Curley, happy nursing.
Happy nursing, Adrian.
Thanks. Here at Nursing Uncensored, we may be, well, uncensored, but we're not unfiltered. Protected health information has been changed and concealed to comply with HIPAA. The things we talk about are from years of experience with thousands of patients, things we've read, stories we've heard. If you think we're talking about you, we're not. Also, we're real nurses here to provide helpful and accurate information, but don't take anything we say as fact without doing your own research. Refer to your state's Board of Nursing, Practice Acts, and your institution's policies and procedures if you have questions about your practice. Lastly, our very strong opinions are ours alone and do not reflect those of our employers, educational, or professional institutions. Thanks for listening, and happy nursing, folks.